Hello everyone, my name is Majid. I'm a mental health professional, a qualified and accredited CBT psychotherapist. What I'm going to be hoping to do with these videos here is to talk about mental health, talk about general well-being, talk about things that are happening in the world that may be affecting us in our general health and well-being. I'll be giving you some hints and tips about what to do to deal with difficult emotions and difficult mental health problems like depression, anxiety, obsessions, and compulsive disorders. I'm hoping to use this channel to be able to give people some general advice, give people my own perspective on things, and I'm hoping that it'll be informative for people and help to start certain discussions as well around mental health. So, in terms of today, what I'm hoping to talk a bit about more is depression. We use this word a lot, we hear it a lot. And when someone is depressed, that can really affect how they feel about themselves, about others, or about the world. It can really affect how they function around their home with their family, around their home in terms of how they look out for themselves, their health, their well-being, their self-hygiene. It can affect their ability to concentrate and to go to work and complete tasks and be able to finish off what they're doing. So I'll talk a bit about in terms of what it looks like, the kind of things we therapists would look out for in a person, and then hopefully in another episode talk a bit more in terms of how we can try and understand what's happening around someone who's being affected by it and what we can do to help them take the first steps to be able to come out of it. So as therapists, we can use general terms like depression, or sometimes use specific diagnostic terms like major depressive disorder to try and diagnose or categorize the type of depression a person is going through. And as therapists, there might be some terms that we use from psychiatry, as we can use certain diagnostic manuals like the DSM, the Diagnostic and Statistical Manual for Mental Disorders. We don't necessarily view it in much way like the medical model would view it, which is to say that there is something inherently wrong with the way the brain communicates through the nerves and the neurochemistry. And whilst those things may be affected, as a CBT therapist, we tend to look at, well, what's the environment, what's the triggers that's going on, how is this person thinking, how are they behaving, what are they feeling. So for depression, among the things that we'd look out for, among the two major sort of signs or the two major symptoms that we'd look out for, is one of them being this sense of losing hope and in losing the sort of positive outlook on things, not seeing things getting better in the short term or in the long term, completely losing hope in terms of what's going to happen in the future, a very dark outlook on things and on your future. And the other thing we'd look out for is definitely the sense of depression, sometimes termed as low mood, where you feel very drained from not just a physical standpoint, but from a mental standpoint. And there's almost this either complete overwhelming feeling of sadness or completely numb of feelings where you can't really feel anything at all. So among other things we'd look out for is this self-critical voice in your head or thoughts, where when you think about yourself as a person, or you think about the world, or you think about your outlook and your future and how that looks like, you have a very critical voice in your mind. And it keeps telling you things like, I'm worthless, I'm useless, I'm no good, or there's no hope in the future, there's no point in even trying, things are never going to get better. Those type of thoughts can be very closely attached to your mind and thinking about it a lot more frequently than the average person would. Another symptom to look out for would be difficulty concentrating. So you might have found yourself that your concentration levels, and people have different levels, but you might have been at a much better place before. But if depression has started to take hold of you, then you might find that you're much more, you have a much more difficulty in concentrating on when someone is talking, or when you're reading, or when you're trying to complete tasks. It can be difficult to make decisions on account of that, because things are just getting so muddled up and overwhelming that you're having difficulty to coming up with decisions at all. Another thing which can come up, another one of those symptoms of depression, is this part where you might not necessarily be thinking about committing suicide, but you'll have these really difficult and dark thoughts to have about perhaps things being easier off if you weren't alive. Perhaps thinking that you wouldn't be a burden towards others, or you wouldn't be noticed at all if you passed away. And those are really difficult thoughts that people can have, and sometimes they can go over to being much more frequent and much more intense, and go over to being actually parts where you're thinking about suicide or how you would die. And I really do hope if anyone is going through those type of thoughts that they seek out help immediately. The best thing to do would be to speak to someone that you can find and someone that you can trust, a good friend, a family member, be that your brother, your sister, your parents. And if you can't get hold of those people, that you phone your nearest emergency center. If you can reach your medical practitioner, your general practitioner, reach out to them or call your emergency phone numbers. Another symptom to look out for when someone is depressed is a change to their demeanor in terms of the pace or the way that they speak or the way that they move. And generally, you might find that they move or speak a lot slower than usual. They might not be as reactive to returning back your speech or being able to reply back to you. A lot slower doing certain things as well. And that could be related also to depression. There could be other things going on as well, but that's also something to look out for. If you find yourself moving and speaking slower than usual. And sometimes the opposite thing could be true as well, where you're more fidgety and restless on account of other symptoms that you may be facing as well. Another big marker for depression is changes to your appetite and your sleeping patterns. So you might find that you're perhaps eating a lot less than you used to, or that you've lost your appetite, or that you're just nibbling at small little snacks instead of having your regular meals. The opposite can also be true, where you find yourself overeating or snacking a lot on high-calorie foods, high-sugary type foods. And this could be for several reasons, but among the reasons that you comfort eat is that you are trying to numb down or at least get some sort of sensation. So you can't feel anything inside, or you're trying to numb down really difficult emotions. And when we eat, that can be a really strong distraction from those difficult emotions that we're trying to avoid when we're being depressed. Your sleeping pattern likewise can change to the two extremes, where you might have a lot of difficulty falling asleep or staying asleep on account of having a lot of thoughts in your mind, a lot of rumination where you're thinking back to things that happened before and how you could have perhaps done differently, or how things could have turned out differently. Or the opposite can also be true, where we sleep a lot more than usual. So we stay in bed a lot more, stay covered up a lot more, and that helps us to hide away from all the things and all the demands of daily life. Thinking about all these mentioned symptoms, a big marker for knowing that this is now starting to become much more serious than just a phase of a small bout of depression, which most people can sort of come out of on their own, is when it's really impacting your daily life. So if you have responsibilities as a husband, as a wife, as a child, as an employee, as a student, as an organizer, there are people who depend on you, or you need to get work done, and you find yourself that you're unable to keep hold of those responsibilities, those tasks that you need to complete. So they can be around work, and you're unable to finish the work that you do. You can't seem to be able to retain information, talk to people, concentrate what you need to get done. It could be around home, your tasks around the home, which involves cleaning, tidying, shopping, cooking, looking out for the children, looking out for the finances of the home. Your ability to look out for yourself, your own health and well-being, your self-care, the interest, your old hobbies, the things that you used to enjoy. If you find that you're leaving off a lot of those things that you previously used to attend to, then that's a really important thing to look out for, and it puts you in a place where you need to ask yourself, is this problem something that I really need to get hold of? Is this problem now something that I need to ask help from other people to help me around? Your ability to socialize is also a very important mark to look out for. If you found yourself finding it easy to speak to people, you had a lot of relationships with family and friends, you were someone that people were depending on to talk to, and now you're sort of avoiding people. You're avoiding phone calls, you're avoiding knocks on the door. If you manage to get to work, you might hide yourself at a corner. This could be an indication as well how those symptoms are really starting to impact your ability to socialize. So these are just some of the symptoms to look out for. And there's a lot more things to look out for, but generally speaking, it's changes to the way that you think, the way that you used to behave and how you feel. This overall sensation of low mood and loss of hope, along with the immediate impact on your ability to complete tasks around work, around home, around family, around your social life, around yourself and well-being. Those are the sort of major things we'd look out for as therapists. And we want to help this person to first and foremost understand what started things off, and then more importantly, what's keeping things going. If you weren't at that place, if that person didn't have all these problems a few months ago, maybe even a few years ago, maybe even in their childhood, then that would suggest to us that there's something that's grabbed hold of this person. And perhaps they're stuck in some cycle where they keep going through the same motions every day. They have difficulty getting out of bed. They have difficulty talking with people. They have difficulty getting their meals in. They're not returning calls. They're not looking out for the bills. They're not getting things done which, at the end of the day, when they look back, they have a sense of regret. Why didn't I get these things done? There's a part of you that knows something is wrong and it wants to come out. And being able to come out of that cycle is where the therapist comes in to help you to look at that vicious cycle that you're in and how we can come out of it. So I hope you found this video informative. I'm going to release a few more episodes about this going forward. And I'm going to get into talking about how we can understand depression or any other mental health problem, and talk about what tools we use as therapists to understand the problem that we're having, and then finally the kind of things we'd look out for to help people to be able to come out of the vicious cycle that they're entering into.